Hello, kindly introduce yourself.
Hello, I'm Bethlehem Deananeas.
Okay, and how old are you?
I am 36 years old.
Okay, are you married?
I am a single parent with a 13 years old son.
Okay. Who's taking care of your son?
My sister,
My sister. Okay. What is your educational attainment?
I am a high school graduate.
Okay. Did you had an experience working abroad?
Yes, ma'am. I was working in Riyadh, Saudi Arabia for 2 years. In Qatar for 2 years also. In Singapore for 2 years.
Okay. In Saudi, how many family members did you serve?
I serve 8 members of the family.
Okay. Was there small children?
Uh, the children is 17 years old, 13 years old, 9 years old, 6 years old, and 4 years old.
Okay. And you were the one who's taking care of them too?
I am the one who's taking care of the children, uh, do the household chores, the general household chores, cooking, and also the taking care of the elderly also.
Okay. Is this elderly still mobile or?
Yes, the elderly, the elderly is mobile, the wife and the spouse are mobile, both of them.
Okay. How about in Qatar? How many family members did you serve?
I serve 6 families. It was a grandmother and the wife and the spouse and the 3 children, who's an adult already.
Okay. The elderly is still mobile or disabled?
The elderly is a bedridden.
Okay.
He has his special needs also.
And you were the one who's
I am
taking.
the one who is taking care of the elderly. It's a female. I give her medicine. I cook for her food. I prepare her when bathing
Okay.
and doing all the household chores.
Okay. And you were carrying her?
I carry her from bed to the wheelchair and from wheelchair to the bed, and I change diapers for her. I changed clothes for her.
Okay. And in Singapore, how many family members did you serve and what were your duties there?
I serve 6 members of the family. The family is a Singaporean Chinese. There are 6 in the house.
Okay.
But I also work general household, but I focus on the taking care of the bedridden patient who
Okay.
is a male. I am the one who is changing her diapers, bathing for him, doing some exercise like a physio, because I was trained a physiotherapist. I exercise the patient, I massage the patient, I giving him all the medicines that he needs, and also for the changing of the trachea tube, because he was operated. He is a operated person.
Were you trained for that?
I was trained in a Tantoxin Hospital.
Oh, okay. That's very nice. If you go to Malaysia, what do you want to take care?
If I'm given the chance to go to Malaysia, I want to take care of elderly also, bedridden person, because I'm used to it. I think I'm mostly efficient in doing those tasks, and also for general household also, for taking care of baby like 1 year old and above.
Okay. How long do you plan to work in Malaysia?
I will work in Malaysia because I am already, I know that I have a 2 years contract in Malaysia. If it depends on the employer on how long I can stay in their family.
Okay. It means you are more than willing to extend. If you
Yeah, it
apply.
depends on the family if they want.
Okay.
If they want me to extend.
Okay. How many day off or rest day would you like to have in a month?
I would like to have a 2 days, 2 off days in a month.
Okay. And staying inside the house is okay with you?
And staying during my off days, I just want to stay in my room for some rest.
Okay. With regard to cell phone, are you willing to surrender it to your employer during
Yes, I am willing to surrender it. I know how to manage my time, and I know my job. I know what is my job. I know the reason why I came there. So maybe I think I should ask for permission to use my mobile.
Okay. Why did you choose Malaysia this time?
I choose Malaysia this time because I want to work for the Malay family also. Then to experience the place in Malaysia. Then I also want to have more experiences,
Okay. At different places.
different places. Yes.
What is your goal this time after 2 years? What do you want to achieve?
I just want to for 2 years.
Yeah.
My goal is that just to finish my contract, and if the employer will let me extend, let me work for them, then it's good.
Okay, well, that's it for our interview today. Thank you so much for your time.
Thank you, ma'am.